My name is Terry Lynch. I'm a third-generation insulator. I'm the International Vice President with the International Association of Heat and Frost Insulators and Allied Workers. We were formerly, up until 2007, we were the Asbestos Workers Union. I'm also our legislative director and our health hazard administrator. I've been asked to talk to you today about protecting worker safety in the 21st century. 100 years ago, Upton Sinclair wrote The Jungle, an award-winning book about the horrendous working conditions and deaths in the Chicago meatpacking industry, which is headquarters just a few miles south of here. Earlier this week, the New York Times reported on the coal mining disaster at the Upper Big Branch mine in West Virginia. We now know that tragically 29 miners lost their lives in that disaster. This is one of the worst mining disasters in the last 20 years. Early reports seem to suggest that the underground explosion occurred because of the buildup of methane gas. The media has reported on the awful safety record of this coal mine owned by Massey Energy Company. The Wall Street Journal reports that the mining company was fined almost $1 million just last year and was issued over 450 safety violations, some of which dealt with faulty ventilation systems and improper roofing systems that would protect a worker's escape from a mine during a terrible disaster. You know, and I might add that there's a tremendous similarity between the asbestos workers and the mine workers, you know, of the black lung disease. They're little people that go out to work for their families and stuff, and they're good jobs. It's awful. It's heartbreaking. The Journal reported that the company knew how to work the regulatory system, as they appealed most every finding of safety violation. Delay, rather than addressing the safety problems, seemed to be the mode for what they wanted to do. So I might ask the question, why are we still having preventable mine disasters today, or preventable workplace injuries? Why do over 2,000 Americans continue to die each year with mesothelioma, a signal cancer whose only known cause in the United States is exposure to asbestos, with countless others dying of asbestosis and asbestos-induced lung cancer? What can we do to prevent workplace deaths in the future? How can we come together to protect the worker in the 21st century? Before I try to answer these questions, I thought I might tell you a little bit about our union. Our international union is 107 years old, being established in 1903. Over the years, we have been known as the pipe covers, the insulators, or asbestos workers. Since we don't apply asbestos to pipes, boilers, and ducts anymore, we are now officially known as the International Association of Heat and Frost Insulators and Allied Workers. When my dad and grandfather started in the trade, they didn't know that asbestos exposure was dangerous or that it could kill you. When I started in the trade in 1966, we were still applying tons and tons of asbestos pipe covering block and cement on major industrial job sites, like the pictures we had seen before, at Waukegan Powerhouse. Manufacturers told us that their products were safe to work with. Let's take a look at this picture. There are a couple of our guys working. The picture is from an Owens Corning Kalo product brochure. Shows two insulators working with asbestos pipe covering on a high-pressure steam line. Could very well be in Waukegan Powerhouse. And see their hats with the dust on it and everything. This is a brochure from the company saying everything is fine. Note that these workers are shown without any masks or respirators. Little did we know in the 70s that Owens Corning had known for over 30 years that asbestos exposure like this, without masks, could cause mesothelioma, lung cancer, and death. Owens Corning's marketing materials at that time said that their asbestos insulating products were non-toxic and promoted workers' well-being. Let's look at one more picture. This is a Pittsburgh Corning brochure. Again, the guy working with no mask, unibestos, And this is a brochure from the company telling everybody that everything is fine. I worked with tons of Owens Corning Kalo asbestos, seen in the last photograph, and I worked with tons of asbestos Pittsburgh Corning asbestos. In this second photo, similar to the first, the product brochure shows the insulator working with the product without a mask and a respirator. This brochure was 1972. In the early 70s, major industrial facilities in Chicago and elsewhere, refineries like Mobil Oil and powerhouses like Commonwealth Edison, now Midwest Generation, specified that asbestos products were to be used on job sites. Over 100 boxcars of asbestos insulation was used on every one of these sites. Asbestos dust would get in our hair, on our clothes, and our shoes, and we would bring the dust home every day. If you shook a container of talcum powder on someone, that would look at the end of the day just like we would come home to our families. Because mesothelioma and asbestos-induced cancers can occur 15 to 40 or more years after asbestos exposure, which is known as the latency period, we are still suffering deaths from exposure that started in the 50s through the 70s. Some experts expect that over 2,000 U.S. citizens will die each year from asbestos-induced mesothelioma for decades to come. And yet, asbestos is still mined in Canada and sold to third world countries for active consumption and use. Today, we still have people in the United States that are trying to minimize the importance of safe work practices when it comes to asbestos removal abatement. 2 days ago, I was forwarded a newspaper article from Marco Island, Florida. The article reported the recent fines that the EPA entered against a contractor and a city for improperly removing asbestos containing underground pipe. Today, untrained workers will go to a job site and be told, knock off the insulation products that contain asbestos, exposing themselves and their families to needless exposure and possibly death. So how are we to protect workers in the 21st century? Perhaps I might offer a few thoughts. Workplace safety is the responsibility of many. To be successful, it must be a team effort among manufacturers, premises owners, employers, and labor. Manufacturers must warn users of their products in clear and simple terms about the hazards in working with or being exposed to their products. When I walked on a job site, the owners of the large industrial and commercial job sites where I worked knew a lot more than I did about what hazards were on the premises. Premises owners all need to disclose what they know and assist the contractors and workers by providing a safe place to work. Employers need to interface with premises owners and safety engineers to ensure that there is a safe working environment for all workers. They need to make sure that proper safety equipment is present and in use on the job site. Labor, too, has its part in protecting the workers in the 21st century. Workers and their unions do not have the resources of manufacturers or premises owners, but we must train and educate our workers regarding health and safety issues. Because our union installed asbestos insulation in the United States and Canada for over 65 years, we became very involved in the new asbestos abatement and removal industry. We were and continue to be determined to work with the appropriate agencies to ensure that our workers and the general public are no longer put at risk. In the early 1970s, various federal and state agencies became more involved in addressing asbestos risks and workplace issues, helping to establish the regulations in place today. The agencies responsible for creating, monitoring, and enforcing asbestos laws and regulations include the Environmental Protection Agency, the Occupational Safety and Health Administration, the Department of Transportation, state agencies such as the Illinois Department of Public Health, as well as local, county, and municipal health agencies. I can't emphasize how important the work of these agencies are in protecting workers and the general public. This is a picture of a person and how they should look when they're removing asbestos with the proper equipment on. In June of 1986, the original OSHA standard on how to safely remove asbestos was written by Bob Martinotti at the OSHA Training Institute, located not too far from here in Des Plaines, Illinois. Today, the EPA and OSHA require mandatory training for workers and supervisors. Anyone who removes asbestos must complete a 32-hour initial training course. Supervisors must complete a 40-hour course, and they must, before you become a supervisor, you have to work in the field for 2,000 hours. All workers must provide a certificate of training and a state license to work on a job site. In addition, every worker must provide medical documentation from the physician before he or she can work on the job site. This includes an X-rays, a pulmonary function test, and verification from a physician that the worker is capable of performing work in this kind of an outfit, especially with the respirator. These are just some of the mandatory guidelines and requirements in place to protect the workers from the dangers of asbestos. When I was an insulator, working in the 70s and early 80s, these provisions weren't in place. In the 1970s, I remember removing asbestos without wearing any protective clothing. If I did that today, I would be breaking the law. The International Association of Heat and Frost Insulators and the Allied Workers Union has established 86 training facilities across the United States and Canada. Approximately 20 of them have certification to train for asbestos removal licensing. Today, the vast majority of our members complete a 4 or 5 year apprenticeship program certified by the Department of Labor before they are awarded their journeyman's cards. The only members who do not go through the apprenticeship programs are the people that we organize through the open shop. One of the differences between the union and non-union workers is the emphasis on safety and training. Union contractors and union members invest a great portion of their wage package to ongoing safety training in all facets of our industry. I would also add that our union works closely with the AFL-CIO and its Director of Safety and Health, Peg Seminario. We also work closely with Pete Stafford, the Center to Protect Workers' Rights, which is the health and safety arm of the National Building Trades. These are both great departments that the Insulators Union is very proud to be associated with. Their sole purpose is to make the workplace safer for all workers, union and non-union. Today, our hearts and prayers go out to the West Virginia miners and their families. In the 21st century, there are a lot more resources available to protect the health and safety of workers. It is evident that President Obama and his administration are truly concerned about worker safety. Innovative measures have already taken root. This past Wednesday, I participated on a webinar on strategic planning for worker safety conducted by Dr. David Michaels, the Assistant Secretary of Labor and Administrator for OSHA. Next week, I plan to attend the first Latino Workers' Health and Safety Conference in Houston, spearheaded by new Secretary of Labor, Hilda Solis. I particularly look forward to hearing Deputy Assistant Secretary of OSHA, Jordan Barab, speak today. Health and safety in the workplace is a 24/7 proposition. We all need to do our part. Again, I want to thank Linda Reinstein and ADAO for your tireless work in making people aware of the horrors of asbestos exposure and your courageous fight for a total ban of asbestos in our country. Our union stands at your side in this fight.